Frozen shoulder is a condition in which you feel pain, stiffness and loss of normal range in shoulder joint. The pain and stiffness begins gradually and it takes 1 to 3 years for this condition to develop. Frozen shoulder comes in 3 stages. First is the freezing stage. Pain is the most prominent feature of this stage. Pain starts in the shoulder anytime you move or work, which slowly gets worse. The time period for this stage is 6 to 9 months. In the second stage of frozen shoulder, which is known as the frozen stage, pain might get better, but stiffness gets worse and it becomes very difficult to do daily activities. The movement is most restricted in this stage and it takes 4 to 12 months for this stage to develop and go away. The third is the thawing stage, in which the shoulder begins to melt and range of motion starts to go back to normal. This takes 6 months to 2 years. Shoulder joint is made up of different structures, bones, ligaments, tendons, and it may look like this. First is the bone of your upper arm, known as humerus. Second is clavicle, and third is the bone of your shoulder blade. Upper arm and shoulder blade makes ball and socket joint. And surrounding all these structures is a joint capsule made up of connective tissues. And inside that capsule is a synovial fluid that lubricates and helps the joint move easily. Now, what happens in frozen shoulder is that this capsule becomes thick and tight, making movement difficult. The synovial fluid reduces, further restricting the movement. Thick bands of connective tissue known as adhesions are also formed. The two hallmarks of frozen shoulder are pain and stiffness. The pain, which is dull and achy and usually occurs in one shoulder. The pain is severe and worsens at night. The stiffness that is so severe that it limits the normal ranges of shoulder joint and prevents you from doing everyday chores. The cause of frozen shoulder is not clear, but there are some things that you may need to know. It is present more commonly in women than men. It is most commonly present in 40 to 60 years of age. Certain medical conditions increase the risk of frozen shoulder, like diabetes, heart disease and thyroid disease. Long periods of immobilization can increase the chances of frozen shoulder, as in case of stroke, mastectomy or any major arm surgery. Mostly, physical examination is enough to diagnose frozen shoulder. Imaging tests like X-ray, MRI, ultrasound are used to rule out other causes of shoulder pain like arthritis or rotator cuff syndrome. There are many treatment options available for frozen shoulder. Early treatment helps the condition from getting worse. Oral medications to reduce pain and inflammation, corticosteroid injections into the joint, manipulation under anesthesia or surgery. Surgeries are rare but can be done in frozen shoulder cases, and alternative medicine. Physical therapy is the primary treatment recommendation for frozen shoulder. Physical therapists help you move. So in case of frozen shoulder, when the movements are restricted, physical therapy is the best option. Physical therapy focuses on reducing pain through different methods and regaining range of motion with stretching and strengthening exercises. Some exercises can only be done by a physical therapist, in which he performs passive movements on you. others can be done via a home program. To learn how to treat frozen shoulder at home, keep watching Wheezy Fitness Studio. If you like this video, please share it and subscribe to our channel.